but people don't really think about the long-term impacts of the sun on themselves. And the focus, of course, is skin cancer. Nobody wants to get skin cancer, and so wear sunscreen so you don't get skin cancer. Well, by the time you get skin cancer, the damage that you've done to your skin is so far past that. I mean, what you're looking at in the mirror doesn't look attractive. You don't like it. And that the injury to your skin, the harm it causes, actually ages the rest of you. I mean, it actually causes whole organ and body aging, and people don't really think about that.
Welcome to the Precision Medicine Made Simple podcast, where we simplify the complex world of precision medicine. We're here to explore how personalized healthcare can empower you to understand and improve your health to live a longer and healthier life. Join us as we break down the latest in medical science into actionable insights. Let's make precision medicine accessible and actionable for everyone. Enjoy the show. Today's episode is sponsored by Biography Health, where healthcare meets personalization. With their DNA-enabled blueprint, Biography Health empowers you with a health plan based on your unique DNA, aiming to prevent disease and extend your life. Take control of your health journey with a plan as unique as you. Visit biographyhealth.com and start your personalized healthcare journey today. As a reminder, this episode is for educational purposes only. This episode is in no way a replacement for professional health advice. Please consult with your professional primary care provider for medical advice. If at any point you feel that a topic discussed on our podcast was misrepresented, or if you have additional insights that could enhance our discussions, we wholeheartedly encourage you to reach out to us. Your feedback is invaluable in helping us improve and in ensuring our content remains both informative and reflective of the latest developments in precision medicine. For this episode, we dive deep into the intersection of aesthetics and longevity with Dr. Cory Goldberg, a renowned plastic and craniofacial surgeon. Dr. Goldberg bridges the art of aesthetic medicine with the science of precision medicine, sharing groundbreaking insights on how oxidative stress affects both beauty and overall health, and discussing innovative approaches to extending both beauty span and health span. Hey everyone, welcome to the Precision Medicine Made Simple podcast. I'm here with my co-host, Dr. William Stanford, and then for our guest today is not only a renowned plastic and craniofacial surgeon, but also a visionary in integrating wellness and longevity into patient care. With a philosophy centered around extending both beauty span and health span, he bridges the art of aesthetic medicine with the science of precision medicine. Through a holistic approach that aligns personalized treatments with long-term well-being, he is redefining what it means to age beautifully and healthily. Please join me in welcoming Dr. Cory Goldberg to the podcast.
Thank you so much. That's a wonderful introduction. I really appreciate it, and I'm really excited for our conversation.
I'm really excited for this conversation too, because out of all the other guests that we've had, this is definitely coming from a different perspective and realm, because most of the guests that we've brought on have been more, I guess, catered towards just preventing chronic diseases, but the plastic surgery approach to it is very different. And so, and I was taking a look at your background, and I mean, you were a private pilot, then you got into longevity and wellness, and then you've plastic surgery. And so I was kind of curious, how did you get into precision medicine, and really just what were some of those key touch points and background points that really led to this trajectory and this path?
Well, for sure. I guess my interest started with my undergrad, which was a degree in physiology, and learning how the human body functions and how it works was kind of the cornerstone. And when I got to medical school, understanding pathology and how things go wrong, it's great to kind of know how it goes right and how it's supposed to work. So that kind of got me going. Through my plastic surgery residency, I took a couple of years off and did what was called the surgeon scientist program, which allowed me to do a master's degree in applied science, and I focused on materials and stem cells. So I was actually trying to engineer bone, and so I learned lots about stem cells and cellular and engineering tissue. So that was a huge learning time for me, and I was in an engineering faculty for that. And then when I finished my residency training, I went down to California, did my pediatric craniofacial training. So that kind of gave me a bit of a flavor of different healthcare system, and that started my evolution. When I started in practice back in Toronto in plastic and craniofacial surgery, it didn't take long for me to recognize that people walking through my door, they had a very similar profile. There were the young people come in for breast augmentations and that kind of thing, and of course they're young and healthy. Nothing's happened to them yet, but anyone coming to me for rejuvenation, metabolic syndrome, diabetes, heart disease, the Crestors and Lipitors, everybody's on the statins. Everyone was on the same series of medications, and they all seem to have the same issues. And I recognized this pattern, and I started getting more involved in my patients' health. I was introduced to a product that got me very interested in oxidative stress and its effect on healing from surgery and on patients and health in general. And that just started me down the path. As soon as I started looking at ways at a root cause of preventing health issues and trying to help my patients have a better healing process and getting through surgery, that just started to translate into a greater interest in health and well-being and precision medicine. And I had my own personal experiences in my own health, and a transformation around 2010, 2012 that was part of the journey. I watched my father, who was a surgeon himself, decline over 10 years, and his career was ended because of health issues. And I really recognized this pattern of, we're really missing the boat in healthcare, and we're waiting for people to get sick and things to break. And so that's it. That all that kind of lead up, and then the personal recognitions and my patients. I'm at a place where I realize that our healthcare system is not doing it right. And honestly, I really don't think the aesthetic world is doing it right either. And I think that there's a juncture there and an important recognition in both of those worlds.
Yeah, I'm interested in more of that. What do you think that the aesthetic branch of medicine, how are they missing the boat?
Well, they're mirror images. Honestly, the standard sick care model of waiting for something to break and then trying to fix it.
Right.
In the aesthetic industry, it's really no different. Again, there's the younger population that come in for more structural things like rhinoplasty or chin genioplasty and that kind of stuff. That's more of balancing. That's very different. What I'm talking about here is the rejuvenation, and in the rejuvenation world, it really is all about you have sun damage. Let's laser it off or peel it off. Your skin, you've lost all the collagen and elastin. Let's surgically take some out and stretch it so that it can stretch some more as it loses more elastin and collagen. We've come to believe, or society has come to believe, that beauty comes at the edge of a knife or at the tip of a needle. It's all about the therapies, but no one is addressing the root causes of these problems. And so I think that there's an intersection there where we can really get people interested in looking after themselves for the beauty purposes. But that's a gateway. I mean, that's a way to get people to really take care of themselves in the bigger picture. And the aesthetics may be the reason that they come through the door. But with the right strategy, I think we can get those patients to really look at themselves in a more holistic fashion.
Wow. Yeah. So I definitely see that in my younger patients as well. They have an interest in aging beautifully, aging aesthetically, aging well, and that definitely gives you the opportunity to. And for me, I don't have haven't thought through it as much, obviously, as you have, but just even basic things like staying out of the sun, avoiding oxidative stress, keeping your metabolic situation under control. All those things are going to help you age aesthetically better. But I know you take it to a lot deeper level than that. I can't wait to hear all of it.
Well, all the things you just hit on, I think those are a lot of the cornerstones of how people can take care of their own health. I mean, the sun, let's talk about the sun. I mean, the basics, of course, we'll talk about wearing sunscreen, but people don't really think about the long-term impacts of the sun on themselves. And, the focus, of course, is skin cancer. Nobody wants to get skin cancer. And so, wear sunscreen so you don't get skin cancer. Well, by the time you get skin cancer, the damage that you've done to your skin is so far past that. I mean, what you're looking at in the mirror doesn't look attractive. You don't like it, and that the injury to your skin, the harm it causes, actually ages the rest of you. I mean, it actually causes whole organ and body aging. And people don't really think about that. So, wear sunscreen, protect yourself from the sun. That message starts with okay, you don't want skin cancer, but that's 20 or 30 years from now. The next thing is, by the way, if you watch your sun exposure now, you're not going to need your Botox quite so much because you're not going to form so many wrinkles, and you're not going to lose as much volume. And by the way, you're going to lower your risk of heart disease on top of that. People don't put those pieces together, and I think part of our roles in as clinicians is to help people kind of see those pieces.
I can imagine there's like different types of sunscreen as well that works better for some individuals versus others then, right? Or is it pretty generic all across the board?
Yeah, it's a really good question, and my personal approach to sunscreen is a very simplistic one. I guess the first thing is the chemical sunscreens to some extent have been associated with skin issues and actual harm. Having said that, you really have to use a lot of that over a long period of time. I don't personally think that that's a big motivating factor here. Although I do recommend in general, mineral-based sunscreens, which are not associated with those things. That's the ideal, but not everyone has access to that. And so I try to keep it simple for people. Whatever sunscreen you're comfortable using and you're willing to put on, whether it's because it's easy to apply or it's light, or it's cheap and readily available, at your pharmacy, my advice is use that. And of course, the cheapest sunscreen is a proper hat and an awning or something that you can sit underneath. Those very simple strategies, but really compliance is the most important part of sunscreen. And getting someone to comply if they don't like the sunscreen they're using is not, that's not benefiting anybody. So, I approach it, pretty simplistically, just get someone to use it.
Well, and I mean, one thing that I kind of wanted to go back on and really trying to dive into, I guess I don't know if the correct term is the tactics of this, because you mentioned that when people want to, let's say, look aesthetically beautiful, that's what gets them in the door. And then you start to talk to them and start to talk about prevention then. Now, when getting them in the door, does that come with like DNA testing then? Like what are we doing in terms of tactics to help guide the patient through prevention then and keeping them informed?
Great question. So the genetic testing is something I offer patients, and I don't get everybody to do it because it's a barrier. I mean, the cost and the involvement. So not everyone is willing to go down that path, but I definitely introduce it and I encourage my patients to do it. When it comes to my surgical patients, I definitely encourage them more down the path of the biomarkers and genetic testing. And that's sort of a way of explaining it to them. You're going to have surgery, you're investing in yourself, and here's a way that you can learn about your healing or some of the dimensions of your skin and the collagen or the oxidative stress in it. You can learn about yourself. And when it comes to genomics, of course, once you have that data, that's there forever. Your genomics are not going to change. So by getting that done, someone has that on board that they can look into again in the future. So, my introduction to my patients when it comes to the surgical patients is, we're already doing some blood work. What if we did something more and gave you this information that we can leverage for to benefit you in healing, and that you can use into the future for all kinds of different purposes. And that's how I kind of get them involved. And I'm expanding that into sort of an overall strategy for aesthetic patients, and how to transition even the ones coming in for injectables, and offer them AI analytics and very basic things that will allow them to look at themselves at a much higher level rather than I have a wrinkle, inject it. Now it's okay, I have a wrinkle and I can inject it, but here are all the other components that I could try out. And it's like, I kind of look at it like gamifying health. If you can gamify someone and get them interested in their own health and adjusting themselves, that's a win to me. I mean, if you can get someone addicted to Candy Crush or whatever other app that's out there, if you instead can get them doing the same thing on their own health, that to me is a huge win. And each one of these little pieces that they have that gives them that information, that kind of tease of, oh wow, I didn't realize that about myself. That's the catch. That's the bringing them in to look after themselves.
Now, and this is just an idea that came off the top of my head though, with like, do other plastic surgeons also agree with this like approach as well? Because from one end, like I'm assuming that if, you mentioned, let's use the wrinkle example, right? Like wouldn't you want your patients to have more wrinkles then, so you can then operate on them more? I mean, I'm not saying that's ethically or morally correct or anything like that.
If there's the sick care system and the health care, then this is the ugly care and the beautiful care.
I love that. That is the best comparison. I couldn't agree more. That's absolutely it. In plastic surgery, I think that this concept of beauty span and what I'm talking about here, it's a relatively new idea. I've got lots of good feedback when I speak to my colleagues and I present this to them, and it's really a whole new world. I mean, plastic surgeons in general, of course, we have a very focused view of the human body and the physical manipulation of it to create health. There's a very fixed mantra in the sort of standard, current traditional medicine, and the aesthetic world is no different. So, I have a bit of an uphill battle in that way to try and make sure, people understand the rationale behind this. In plastic surgery right now, there are physicians who have adopted regenerative medicine, again, it still comes as a therapeutic. It's a I can put exosomes on that, or I can give you an IV infusion for this, and therapeutics have 100%. There's a role there. But I feel like, as clinicians, we have a bigger responsibility to get people looking after themselves at a higher level where their behavior and their choices are being evaluated. When a patient comes to me and asks for surgery, I will absolutely have a discussion with them about exercise and diet. I don't know that all surgeons will go through that, but I take the extra time because to me, first off, learning about their diet is hugely important because it definitely changes their healing. It changes the surgery and their quality of tissue. That's my opportunity to say, okay, you're having surgery. Here's what you can do to change your behavior to make you heal better, to have a better outcome, to have safer surgery. Plastic surgeons don't. I don't know that they have that mentality yet. So this is, I'm trying to get the good word out so that we can change as an industry, not just as plastic surgeons, but the aesthetic industry as a whole has become very reactive. So, yes, okay, so maybe I'm going to, convince some people to take care of themselves and they won't need a facelift tomorrow. But 10 years from now, they may still need that, or they may need other therapies that we can offer. Plastic surgeons are historically we have been innovators. We innovated surgery through wartime. We have innovated so many different and pioneered so many different techniques. The first kidney transplant ever done was done by a plastic surgeon. So, these things are, plastic surgeons are at the cutting edge of surgery and healthcare in general. We've made so many advancements. I think this is an area where we have an opportunity because the patients are coming through our door. They're coming in for aesthetic treatments. We have the opportunity to then get them over to the other side, to the the holistic picture.
I got a question for you. So with chronic diseases and personalized precision medicine, we like to catch the patients very early in their lives in their 20s and 30s, because that's when these diseases like atherosclerosis, neurodegenerative diseases, metabolic derangements, et cetera, pick up. And, it is interesting that I think they may have very high uptake on these concepts that you're putting out there. We're able to sell the fact that we can delay the onset of chronic diseases. It should be a pretty reasonable thing to connect the dots that by doing some of these same things, they're going to be able to preserve their youthfulness for much longer. And things like, I don't know, I'm sure you've had guys in their 20s with their hair and their physique and women also with their hair, but skin and all that. It's a really attractive concept to be able to link those two things together, health and beauty.
Yeah, I agree completely. Of course, one of the sort of darker sides or less pleasant sides of the aesthetic industry that I've seen in the past, decade and a half or so while I've been in practice, the patients have become younger and younger. Gen Z, they'll walk through the door. To them, getting Botox is the same as putting on eyeliner.
Yeah.
And I don't like that. I don't like the fact that this has become a commonplace thing. However, I think that there's a flip side to that. And the flip side is that these people are willing to walk through a clinician's door to seek care at a young age. And how we receive those people, we could receive them and say, great, you want Botox? Let's start you with 20 units. And next time you come in, we're going to upsell you to 30 units and a lip filler. And I mean, that's where the industry is at presently. But I really think that there's an opportunity with those people walking through the door that we can also say, hey, by the way, here are things that you can do to take care of your own health. And when I first got into precision medicine and was interested in longevity medicine, I really thought the people coming through the door would be the older population, people who are nearing end of life and were thinking about their mortality. But what I've been surprised about is actually it's more of a younger crowd. It's 30s to 40s, what I've seen anyways. And the way I explain this is I think that that's the population of people who have watched their parents age. They've seen their parents getting older, having health issues, and they're thinking to themselves, first off, I have to take care of mom and dad, and how do I do that? And also, I don't want that to happen to me. Like, what can I do to prevent that? And so I think that the younger generations are really in tune to taking care of themselves in a way that the older population is not. And there's a double gateway there too, because that means that the younger population will come through the door looking for things for themselves. But it also means that we can teach them and they can apply stuff to their parents, where otherwise, social media, there's a limit to who you can reach. But if you can reach a population of people through their kids, I think there's a lot of power there.
Yeah, awesome.
I like that perspective too, because I mean, from I guess a different perspective of saying, oh, well, with the younger generation, social media, that I can imagine they're always trying to compare themselves to the 10 out of 10s, the models, the influencers, and the people that think that is bad, and it's just very cut and dry. But then you could use that as a way to educate and inform about, I guess, the other aspects of beauty and helping people feel confidence through, let's say, prevention and other aspects to that nature. And what I was going to say is it clicked in my mind when you were speaking about just the process of prevention, just like in terms of like trying to prevent in terms of healing, right? Now, when oh man, I'm trying to jumble up my words because I haven't had many conversations about this stuff beforehand. Because when
well, can I jump in? I think just having spoken with you earlier about this, and the whole concept of the aesthetics ties into anti-aging, really, at the end of the day.
Thank you.
And what about the molecular processes? Where are we at with that?
Oh my gosh, chemistry wise, you were exactly what I was trying to say. And I did not know how to say it.
Hanging out way too much, Taylor.
You know what, Taylor? I knew what you were trying to ask as well. I could tell. So of course, great question. So let's talk about a couple of different mechanisms and that relationship between aesthetics and health. I guess the first thing is, if you're going to live for a long time, you want to look good. Right. I mean, I don't know. There's enough myths and fables, of yore where, someone wishes for everlasting life, and their curse is that they're granted what they wished for. Right. Nobody wants to live forever. People want to be vital and beautiful forever. So the idea here is, if you're going to be alive a long amount of time, you want to also be healthy and vibrant, and you want to look good while you do it. So those things all fit together in my mind. So, just from a pragmatic point of view, I think these things fit. But from a molecular point of view, how they're related. One of the things that I talk about with my patients is the concept of senescent cells. Mm-hmm. So, as I'm sure you guys are aware, senescent cells are these damaged cells in all of our organs, which don't reproduce and just sit around and secrete a whole bunch of really harmful, substances, which also circulate in our blood and harm other organs. And of course, we the common term for these, the zombie cell, which harms the adjacent cells and causes other cells to take on this persona of just being harmful. And so,
like when one fish in the tank dies and the rest of them start dying, just whatever's released, right?
That is a great comparison. Your body is a fish tank. So one of your fish dies, you better clean it out fast.
Well, I mean, and it's just not the release of bacteria, but it's these other factors you're getting at. I haven't really studied that, but I know that they do that. There's some communication and trips off other cells into programmed cell death and all that other kind of stuff. So can you talk a little about that?
Yeah, for sure.
Especially with the senescent cells.
Those senescent cells, I mean, so they're tripping other cells to become senescent cells. That's why they're called zombie cells, right? Because other cells, take on that same persona. And that's a positive feedback that causes more and more. So here's where they are in the skin. first off, they happen on their own from chronological aging, right? As we get older, we collect these things just from normal wear and tear. Um, we could talk about a root cause of that, but leaving that alone, just being alive for a certain amount of time, we start to collect these. The thing that really struck me, and these are studies that have just come out over the past year or two. First, sun directly causes these things to happen. So sun exposure, 1 hour in the sun actually causes you to have more of these senescent cells in your skin, and it's measurable. You can actually see more of them. And once they're there, it's not like they go away the next day. They're there until your body gets rid of them, or until you take a senolytic or medication that can help you reduce that. But they accumulate. So when you go get that sunburn on your first day of vacation, wherever you go to, that sunburn gives you these senescent cells. Now, the really nasty part about it is that the senescent cell is not just harmful in your skin. Of course, it harms your skin. It ages it. It's one of the causes of you losing collagen and thinning and the pigmentary changes. It also trips other cells to become abnormal and can cause them to become cancerous. So it is a contributing factor to squamous cells and melanomas and basal cells. So those are all the harms on the skin. But the real kicker is that they actually harm the rest of you too. So these things actually increase senescence and these cells in other organs. So your skin, by having an increase of these zombie cells, you are actually aging yourself internally, physically. Your kidneys, your heart, every organ. So aging of your skin ages your whole body, and it works in reverse too, right? I mean, people who are unhealthy and have all metabolic syndrome and such, things show up on the surface of the skin as well. It can increase senescence in the skin. So it's a two-directional street here. It's beauty, the lack of it, and having unhealthy skin with senescent cells actually causes the rest of you to age. And as the rest of you ages, it also causes your skin to age. So, your skin is an organ, right? It all works in a network. And if any one organ starts tripping, other organs follow. Your skin is the same, only you get to see it. And that's aesthetics. That's beauty. So, senescent cells are a key component of how the way you appear actually affects the way your body functions and your overall health. And the two fit together. You can't separate health and beauty. And so to me, that's why, in my mind, the concept of health span and beauty span, it's synonymous. I think the two things are the same.
So what do we do about senescent cells?
And do people build more senescent cells more than others? And if so, how do we know?
Great question. So there is at this point in time not a sort of easy metric of measuring senescent cells that I'm aware of. So it requires biopsy. So it's not an easy thing to track necessarily. But like anything else, there would definitely be genetic variation in that, where some people would be more prone to forming it than others. And so, for example, one of the root causes of the damage that can lead to cancer cells as well as senescent cells is oxidative stress. And oxidative stress exists in all of us, but there are some variations in how we handle that. So, for example, one of the enzymes, or I won't say one of them, the enzyme that keeps us alive and prevents oxidative stress or manages it in our cells is superoxide dismutase, SOD. And this SOD superoxide dismutase, it's a remarkable enzyme. It is in every single living organism on the planet. It has been conserved over 2.8 billion years. It is the enzyme that saved us from when oxygen started to build up in the atmosphere when photosynthesis first evolved. This is the enzyme that prevented us from going completely extinct. That event, by the way, that was called the Great Oxidation Event. Yeah. We would have all died. Like there would have been no life left. This enzyme SOD helped us to survive. So there are genetic variants in that. So some people produce more than others, or variants that aren't quite as effective. So that's one thing that you can pick up on a genomic test is someone's SOD status. Someone who has poor SOD and poor antioxidant status most certainly would be forming more senescent cells. So that's a way of tracking and sort of telling someone what the risks are. And then, there are senolytics that you can take. That's, a kind of a new category of drug. Some of the common ones are fisetin and quercetin. I personally take one of my supplements in my stack. I take fisetin for that purpose. But there are more, lots of different alternatives coming out as far as senolytics and how to manage that. My personal advice in general, of course, before you start stepping to supplements and therapies, step back, manage your senescent cells by staying under the sun, wearing sunscreen. That's one of the principal reasons in doing that. And of course, a healthy diet. that makes sure that you have a functioning immune system. Your immune system can identify these cells and eliminate them, but you need to make sure your immune system is functioning well. And that is, amongst other things, very diet related and exercise related as well. Just as, of course, the immune system, as you well know, for the rest of the body, it is very diet and exercise related. You can up your game in your skin health by doing those things, so that your skin can recognize when you have these zombie cells marauding around, and you can get rid of them.
What role does exercise play in reducing oxidative stress and senescent cells? Tell me about that, because you would think that all that metabolism would be ramping up the oxidation, maybe, but we all know intuitively somehow it's good for you. So how do you explain that?
So the exercise, the way that works. So yeah, exercise induces oxidative stress amongst other things, and it's a very low level and very targeted. I mean, these are places in your muscle cells where there's lots of mitochondria for the energy required. It's like a training, in as much as on a gross level, you recognize that when you train a muscle, it becomes more effective, whether that's for endurance in your heart and how it beats, or
that hormesis effect.
Hormesis, 100%. That's it, exactly. So that hormetic effect causes an improvement or increase in the efficiency. And of course, along the way, while you're breaking down fat and reducing the fat that you might have interspersed in your muscle as a part of metabolic syndrome, that also improves the efficiency. Your insulin sensitivity improves. So all those things together really contribute very much to your overall well-being, and muscle function. Muscles are such an important endocrine organ. They're such an important hormone secreting organ. More than 30 hormones come from your muscles. That impacts your brain, impacts your heart, it impacts your skin too. So your ability to heal your skin and get rid of these senescent cells very much depends on this overall management of oxidative stress. And so exercise in the short term does induce that, but through the mechanism of hormesis, you end up becoming more efficient and then reducing your overall oxidative load.
Makes sense.
Can we explain hormesis again? I'm sorry, I got a little bit lost there.
For sure. So hormesis is a concept. It's a mechanism in which a minor amount of harm causes you to heal or to improve a process. So okay. Hormesis is a self-preservation. And so, some of the stimulants that can cause hormesis are, exercise, a moderate amount of exercise. It's a stress on your body. Calorie restriction or intermittent fasting. Those are other, methods of inducing hormesis. And it's the actual act of stressing your body to a moderate and controlled level that you then respond in a way that builds you up, repairs things. And so you end up, that which does not kill you only makes you stronger. In this way, that the hormesis, that's exactly what that's saying.
Is that kind of like the red light therapy? That you're familiar with that idea, to expose people to a certain wavelength? And
Nancy has one. She looks like Darth Vader.
So the red light therapy actually is functional, and there's a lot of good science behind that, and a lot of different ways that it works. But one of the principal ways that works is on the mitochondria. It actually stimulates them to function better, and that helps to reduce oxidative stress, because mitochondria are I would say 90% of your oxidative load. When people think about oxidative stress, they say, from pollution and from smoking and alcohol, and all those things are 100% true. Those exogenous sources of oxidative stress are very real, but the most important source of oxidative stress are your mitochondria. Your mitochondria are kind of like these power plants. They're like coal-fired power plants in your cells that you can't live without them, because you need the energy they produce, but they also produce a ton of smoke and garbage that you got to clean up. That's oxidative stress. So one of the things that red light does is it actually improves the efficiency of your mitochondria, and that helps to reduce the amount of oxidative stress that they are producing. So red light therapy is very real. There's a ton of it out there. Wands and all kinds of things that that's a little bit questionable. You need to know what you're buying. So buyer beware. You need like a full coverage, or at least an area to be covered. ones aren't functional in my opinion. It's hard because not all the systems have data behind them, so it's really tough to know who to trust. So my advice is look into whoever you're buying from, but as a mechanism, as a technique, red light therapy, 100%, it's the real thing.
Yeah. Yeah, I read some of the studies and I was impressed. I was really surprised because it didn't sound right. It sounded a little bit like something you would see on late night TV.
It probably started on late night TV. It's been around a long time, but like many things, traditional medicine kind of turns a blind eye, and whatever.
Yeah.
It's until there's some data that actually makes it real, and
Right.
it's now becoming mainstream and a lot more accepted because of that.
Very interesting. What about I know you know a lot about the gut, skin, brain axis.
Yeah,
Yeah.
that's a fascinating one. I mean, wow. When I read about that, I have to admit, it blew my head. So back to our question and talking about skin and whole body health and how the skin and our organs and our body are related. The skin gut brain axis is fascinating. So, I think we're all aware that there's the microbiome in our intestine, right? The
Right.
bacteria that live there. Our intestine has about 40 trillion bacteria in it, roughly, and that varies a little bit. But compared to the rest of us, which has about 3.5 trillion cells, so our bacteria in our intestine outnumbers us about 10 to 1. And they produce lots of things, which can be really good things and also really not so good things. But that is a huge determinant of our health. And so, the gut microbiome is actually a big contributing factor to the health of our different organs. So the thing that really blew me away is that there is a direct relationship, not just between the microbiome, the bacteria in the intestine, and the microbiome of your skin, the bacteria on the surface of your skin, which, of course, from head to toe, every square centimeter is covered with bacteria. So not only are those two populations related, but those two organs, your intestines and your skin and your brain, exist in a triad. And so the health of the microbiome of your intestine very much contributes to the health of your skin and the health of your brain. So the microbiome, your bacteria in the intestine, alterations of that can cause all kinds of neurocognitive and psychological disorders. It can lead to depression. It can lead to seizure disorder. There is a whole slew of brain-related issues, both neurologic and psychologic, that have been directly linked to the intestinal microbiome. And on top of that, the skin also, there's a whole series of items on the skin that have been related. Simple things like the inflammatory disorders like psoriasis. Skin cancer has been related to your gut microbiome.
Wow.
So, the intestinal bacteria actually changes your mood and the appearance of your skin. So, who would have thought that the food you put in your mouth would really impact your mood and or the appearance and health of your skin? But it absolutely does. I mean, the bacteria in your intestine, I refer to them as kind of like pets. The bacteria are animals, right? They can be wild ones that are not so good for you, or they can be domesticated, really nice ones. You kind of want to take care of the intestinal bacteria like they're your pets. Feed them well, be nice to them, give them some probiotics, give them lots of fiber because that's what they eat. They don't eat what you like. They don't like steak. It does not do good things for them. When you eat those kinds of foods, the not so healthy processed and the high animal content, those things lead to a very not good microbiome in your intestine. And that plays out with neurologic and psychological disorders and disorders of the skin. And so those things are very much related. And that blows my mind.
And lots of metabolic derangements as well.
Absolutely, for sure. And needless to say, metabolic disorders, mostly stem from our diet, and also from the exercise that we would normally be doing to help to manage what we're bringing in. But absolutely, metabolic syndrome and metabolic syndrome and the metabolic disorders that just compounds things, because then that changes the surface of the skin and causes the glycation and buildup of sugars, which then results in skin being less healthy, which then impacts on the rest of your body and impacts your intestinal health. So it's everything is connected to everything. You can't. There's not one thing in your body that is not in some way related to other things, even your brain and your mind. And so the concept that there is a mind and body separation to me is a non sequitur. That is not factual. Your mind, your body, and every organ is all one interconnected entity, and you have to start thinking that way when you're looking at your health and longevity in the bigger picture.
Absolutely.
And
I
I'm
think that's
assuming
been proven. Go
then that's
ahead,
why you
Taylor.
push genetic testing then for your patients then. So you try and consolidate all of this information then to help give them this blueprint or plan or strategy to then try and prevent, I guess.
Yeah, it's like if you want to read a book, you need to learn the language. You need an alphabet, you need words. So to me, genomics is kind of like that. How do you know how to read the book about you when you don't really know in any of the details? And learning that language, learning the variants that you have, that allows you to interpret and say, oh, you know what, I always recognized that I had the skin issue. Now there's an explanation behind it, and there's a strategy hopefully to address it. So that contextualization of your health with the lens of this is my genomics. This is how I interpret my own health. I think that's a very powerful tool.
What about methylation? We're hearing about methylation as a surrogate for aging. How does methylation manifest in the aesthetic beauty span? Does it seem to match the methylation that is thought to be able to approximate a biological clock?
That's a great question. So, I think that as far as biological clocks, as you know, I mean, they've changed over time and definitely gotten to be more accurate. Of course, the most important thing about a biological clock is, two most important things. I mean, one is accuracy, and second is, I guess, decision making and a response to it. I mean, if you truly can make a change to it, and it's accurate, well, then that's a very powerful tool. Methylation, of course, the original Horvath clock was related to methylation of DNA. And just as a quick explanation for those listening in, I mean, the concept of methylation is the idea that these methyl groups get added at certain sites along your DNA, the CPG sites. And what that does is it changes the epigenetics. It changes the folding. So, most people are familiar with genetics or their genomics. Epigenetics is the folding of the DNA in your cells, in your nucleus. And the nucleus contains roughly, if you were to take the DNA of one nucleus and squeeze it into one nucleus, it would be the equivalent of taking 40 kilometers of thread and squeezing it into a tennis ball. It's an immense amount of folding. And your cells, their identity is based on this. So the epigenetics of a skin cell, for example, is that the DNA in the nucleus knows how to fold itself such that it expresses the right kinds of enzymes and proteins so that it functions as a skin cell. So when methylation happens, when those little methyl groups insert along the genetic sequence, the folding is no longer normal. It doesn't fold on itself properly, and suddenly your skin cell is starting to behave kind of like a liver cell or a kidney cell. And it's secreting enzymes and things it's not really supposed to. That's a step towards senescence, potentially cancer, but it's definitely a step towards unhealthy looking skin because your skin is not producing healthy stuff anymore. It doesn't know how to behave. So the combination of methylation and then the oxidative stress and the glycation from poor diet and metabolic syndrome, all of these things build up in the skin, and your skin is like the canary in the coal mine. So, that methylation that's happening is ultimately resulting in changes in the mirror. So when someone wakes up and they look in the mirror and say, where do all these brown spots come from? Why is my skin so red? That's the accumulation of all of that stuff. And methylation is definitely a part of it. And methylation is driven by oxidative stress. It's driven by, sun exposure and actinic damage. So these are definitely things that we can modify and try and keep your epigenetics healthy.
Get out in front of it.
Can you explain what reactive oxygen species is and how it relates to aging?
For sure. You've asked a question about a topic I love, Taylor. I love this topic.
I'm so curious as to know why you love this topic too.
So I was a chemistry geek in high school, and I guess fundamentally I recognize that while life is about biology, biology is based on chemistry. And chemistry, if you want to go back, chemistry is based on physics, and physics is based on math. So, I mean, really, we're all just math at a fundamental level. But on a practical level, we are biologic systems, but we depend on chemistry. And the earliest life forms were just, complex chemicals interacting with each other. We've advanced past that. Okay, we've got more complicated, but our systems are ultimately the same. We depend on chemistry. Reactive oxygen species are one of the, if not the most harmful things that we are exposed to continuously. And a reactive oxygen species is an oxygen molecule that has a charge. And it's a charge in which there is excess electrons, and these oxygen molecules with an extra electron, they are zinging around in our cells. So our mitochondria we talked about earlier, and how there are these factories, they're producing a ton of these oxygen free radicals, these reactive oxygen species, and they have this negative charge. They have an electron on them, and they are just dying to give it to somebody. The problem with that is that the people they give it to are, other proteins, your DNA, and so they harm those things. So, the oxygen free radicals, these reactive oxygen species, if they get to your nucleus, they will pop off one of the base pairs, and suddenly your genomics have been disrupted. Now, your cells are pretty smart; they can recognize errors, and they will fix it most of the time. However, there's these things are everywhere, and it's a continuous process of damage to your DNA and your DNA getting repaired. And all it is a matter of time before your cell misses that. And if your repair mechanisms aren't healthy and not functioning as they ought to, they'll miss things more often, in which case you get to be more unhealthy. So it's a positive feedback cycle. Of course, your cell is filled with proteins or enzymes. Enzymes are functional proteins. Those enzymes are subject to reactive oxygen species as well. Oxygen-free radicals floating around. It's going to donate an electron to some enzyme that's carrying out some really important function, and it's going to destroy it.
It can kind of be a chain reaction too, like oxidative stress begets even more oxidative stress.
You betcha. Well, you know what? The principal place that happens is the mitochondria. So the mitochondria, I mean, the mechanism that they work by is so fascinating. So the electron transport chain, the sort of the collective assortment of these enzymes and different channels where electrons are passed along the wall of the mitochondria. And ultimately, the last recipient in that chain is oxygen. Oxygen receives the electron, and it's ultimately converted to water and hydrogen peroxide. But if there is oxidative stress and there's a bunch of oxygen-free radicals hanging around, that actually causes the process to back up. So the oxygen, which would normally be receiving the electron, can't anymore because there's a bunch of these reactive oxygen species around. It actually reverses the flow of electrons in your mitochondria. It goes backwards. So two things that happen from
no bueno.
No bueno. That's like think about the most of your energy factory, the place that if your mitochondria stopped functioning, I mean, you'd be dead almost instantly.
That's what cyanide does, right?
Yes, absolutely. And that's why it works so quickly. So when there's reactive oxygen species around, when your oxidative stress builds up, it actually backs up the energy production in the mitochondria. So the end result of the energy production, your currency of energy is ATP. So ATP is what our cells, produce in the mitochondria. That's what makes the rest of the cell function and gives us energy. What happens when there's a buildup of reactive oxygen species is it actually causes the process to reverse. In order to balance things out, it steals ATP from the end result and makes it go backwards in this system to then try and balance things out and get rid of the oxidative stress. So the function of that is lowered ATP. It's using up your energy. It's going to make you feel tired because it's taking away the thing you need to live. So that's distressing, number one. Number two, the other thing that happens is it goes backwards. So the start of the electron transport chain is NAD, right? NAD, very popular now. People take NAD supplements and there's NMN and NR and different ways of getting that in. So, there's a generally held belief, and I'm going to be testing a paradigm here because this is, and not a lot of people talk about this. People talk about the declining levels of NAD with age. And as it happens, the organ that's the most affected is the skin. The skin has about a 50% reduction in NAD with age, where other organs are less. It's, 30% in the liver, 20% in other organs. The skin is the most affected. However, the actual amount of NAD and NADH, which is the reduced form of NAD,
Yeah.
it actually stays about the same. That pool doesn't change much. It declines a little bit, but it's actually pretty consistent. So it's not so much that you're losing NAD,
It's
it's
the
that
turnover.
it's like a redox, a reduction oxidation balance. There's more turnover, exactly as you said, going to NADH. So what that means is you have a bunch of NADH molecules sitting around, and that's oxidative stress. So your mitochondria, as they get backed up this way with reactive oxygen species, ultimately what that does is it depletes your NAD. It depletes your ATP, it depletes your NAD while you're busy trying to manage these reactive oxygen species. So in my mind, our declining levels of NAD with age is not so much related to a lack of production of it, but rather that there's an imbalance. You have more NADH and there's more oxidative stress. And that's one of the responses to it. And I mean, the harm that causes is immense.
Sure. Wow. So since you're so knowledgeable about such things, and patients ask me all the time, and I don't have the level of expertise you do to answer the question as well as I bet you're going to answer it here. By the way, is that some green tea you're sipping there?
It's green tea with a
You
little
see, you're getting
pineapple.
your antioxidants right now, real time. You're living the law here. Well, tell us about NAD supplements. Should our patients take them or not?
Okay, so
Liposomal or infused?
It,
What's the deal here?
and for the audience that doesn't know, can we like just briefly describe what NAD is as well?
yeah, so nicotinamide adenine dinucleotide, NAD. So
That
NAD,
explained it.
that makes it super simple. So
Got it. Okay, noted.
So, again, going back to the fact that we're ultimately big petri dishes of chemistry and or elixirs of chemistry, NAD is one of the really important sort of intermediaries in our energy production. So when we break down sugar or any kind of carbohydrate, NAD is one of the molecules that is produced from that. And that NAD then goes to the mitochondria, which then uses it, and it's part of that cycle of the electron transport, where the electrons are kind of transitioned along a series of reactions. But NAD is kind of the starting point of that. There's a couple of different ways. I mean, you salvage NAD, you can recycle it, you can create it de novo, so you can create it from nothing. And so, what has been observed is that NAD levels decrease with age. And so there's a belief that whether this is a driver or a marker of aging, that's still debated. But the premise is because it's such a key player and it's one of those big intermediaries in our energy production, that declining level of NAD, if we supplemented it, then your energy production would go back up. And if that's one of the causes of aging, we can give our patients higher energy levels and perhaps reverse or slow aging by giving them this item that they're deficient in. And so, again, I'm not gonna debunk that because it's true. Those levels are going down. But moreover, there's the imbalance or the shift where the NAD is being shifted to that NADH form. And NADH, again, that's the reduced form. I'll go
But maybe you
chemistry
can
here.
do a gasoline to carbon dioxide. And I mean, one is, kind of the battery, the voltage, and the other is the kind of depleted, reduced form.
Yep, that's it. It's the
Gotcha.
depleted,
The
reduced
ball
form.
has all the NAD at the top of the hill has a lot of energy potential. And as it gets reduced to the proton gets transferred to the NAD, it's like the ball has rolled down the hill. So what Cory's describing is all the NAD balls are sitting at the bottom of the hill, and there's not enough of there and the total number of NAD molecules, if you will, are the same. If you add the ones at the top and the ones at the bottom, it's the same. But the problem is there's too many of them at the bottom, and somehow you need to get more up to the top.
And so then that's where you were mentioning where clinicians are now do they prescribe then NAD supplements then, or do they like how is?
Hey, go ahead, Cory.
Sure. Yeah. So
I'm not taking
I,
that one.
I don't know. I don't know how this works. This is my first time hearing
Also,
about
you know,
this.
it's David Sinclair's name is about to get mentioned. I think.
Well, you know what? David Sinclair is a huge proponent of this subject and NMN and NR and NMN and NR are two oral forms of a precursor of NAD. So you can take one of these two substances, and the difference between the two is very very minor. There's a phosphorus. There's like one molecule difference between the two, and they're both part of the chain that become NAD. So there's a big debate between which one is more effective. And personally, I think it's just an industry issue. To me, both are effective. Both have been shown to increase NAD levels. And I mean, as a disclosure, I take NMN. That's, every morning I take some of that. I take a gram every day. That's one of my standards. I take it under my tongue and in my mouth. I let it dissolve. So the premise of taking that. So it's not a prescription thing. You can get this over the counter. There was a moment in time that the FDA was thinking about converting NMN to a pharmaceutical, in which case it would require a prescription and not be sold as a supplement. But I don't believe that didn't pass, or at least it hasn't yet. So you can still readily get these, online, and you can order it. If you do, make sure you're doing it from a reputable, source. I have definitely heard of people who have ordered NMN from entities that turned out to not be reputable, and what they were taking was actually garbage. So just be aware of that. So
And it can be expensive, so you want to make sure you're actually getting it.
yes, yeah, exactly. And so taking it is reasonable. But again, you got to think back to what's a fundamental underlying cause of these things. That analogy that you gave is perfect. Balls at the top of the hill, balls at the bottom of the hill. You have the same number of balls. So is the right thing going to be to put more balls at the top of the hill so they can keep rolling down? I mean, really, the right thing to do is put something there so the balls don't roll down the hill anymore, or start pushing them back up.
You get to, it's like Lucille Ball and the conveyor belt thing. You gotta have that conveyor belt kind of cycled, in phase there.
I think you and I both just showed our age there, because I don't know how many people know who Lucille Ball is.
I have no idea who Lucille is. I'm so sorry.
Taylor, you got to look that one up. That's a piece of pop culture that everybody should know.
Okay, noted. I have my homework.
Just on YouTube, do Lucille Ball conveyor belt.
Okay.
Yeah, the real thing here is that redox balance, the reduction oxidation balance. And so I think that the right solution is a change. I mean, certainly adding more balls to the mix is a reasonable thing to do, and taking NMN and NR, I think it's a reasonable strategy, reasonable enough that I do it myself. But in addition to that, I think that the next part of the strategy is really changing the reduction oxidation balance. And one of the things that I'm really a huge fan of is an oral form of superoxide dismutase. It's a company called Glycodin. And just as a disclosure, I sit on their board of directors, but I have absolutely no financial relationship with the company. They don't pay me. They've never paid me. I own no stock or equity.
Can you spell that for us, Cory?
Sure. Yeah. Glycodin is Glisodin. Glisodin. And if you go to glycodin.org, all the publications that they have are there. And there's about 20 years worth of data on this material. I've personally been taking it for 15 years. It is definitely a part of my daily stack. So the thing that makes this really an interesting, and in my mind, a really unique molecule, is the fact that the SOD, which it's a protein, right? It's an enzyme. All enzymes are proteins. Proteins are digested. If you eat SOD, which, and again, as I said earlier, SOD is in everything. Every piece of fruit, every animal product, everything you eat has some SOD in it. However, there's not much of it, number one. And number two, you don't absorb it. You digest it. And it gets broken down into little parts, and you absorb the parts. But that doesn't give you the actual enzyme.
Like trying to take collagen and get more collagen in your skin. Same idea, right?
It is exactly the same idea. When people tell me they're taking collagen and how much it makes them feel better, I just have to bite my tongue and not say anything. Like,
I do the same.
not getting there, man. It's not doing
Cool.
anything. That's great. I'm
Good.
really glad you feel better.
Yeah. Yeah.
You can't absorb proteins. It doesn't happen. So the way that the SOD in this glycidin stuff is, what makes it unique is that it's encapsulated on a molecular level. It's actually made into a complex, and it's complex with gliadin. So gliadin is one of the proteins that makes up gluten. So it's actually a really tough, rigid protein, and it actually makes it through the stomach. It doesn't get digested. So, one of the things that makes gluten not good for you is because it's not really digested, and then your intestines are trying to absorb these whole proteins. It can be very inflammatory if you take a lot of that. And that's one of the reasons that gluten isn't so good for us. Gliadin is one part of that. And the glycidin, one of the doses of this stuff has 30 milligrams of gluten in it. Which is actually well below both the US and Canadian recommended daily doses for celiac disease. So people who are truly allergic to gluten, this is below that. So it contains it, but it's not a lot. And the reason that this is important is because the gliadin doesn't get digested. So the process of making this complex is actually a heat cycling process. This gliadin is corkscrewed open, the SOD is inserted inside it, and then it's closed over top. So when you eat it, it doesn't digest the SOD. Your intestines actually absorb it, and it releases the SOD. And there's tons of studies showing the blood levels and tissue levels going up in humans over long periods of time, and safety studies around it. It's miraculous. I mean, it's really amazing because it gives you more of this SOD, and that allows you to reduce your oxidative stress.
And that would be like eating a plant-based diet, only the SOD doesn't get digested even. I mean, it's a way to take advantage of these sources of antioxidants, right? It's like the ultimate antioxidant. It's the real deal antioxidant.
It is. It is. And, I am drinking my green tea, and it helps me, I know, but the SOD is a million times more effective, and literally a million times. So one of the SOD molecules, because it's an enzyme, it uses over and over again. So the SOD, usually contains a little metal in it. There's, copper or zinc or manganese. That's the thing that actually accepts the electron from this, reactive oxygen species. But it does it over and over and over again. So one of these enzyme molecules, one of these SOD molecules can actually catalyze and convert a million oxygen-free radicals and get rid of them. It converts it to water and hydrogen peroxide. Whereas an antioxidant in my green tea here, there's chemicals in here that can, take an electron from one of those reactive oxygen species, but it's destroyed in the process. One electron is exchanged, one molecule is destroyed, and that's it. That's the end of it. It's a boom collapse. They're done. And so it's not very efficient. So even though it is helpful, and definitely I encourage, bringing in antioxidants in your diet, the way your body already handles that. And as I said, every organism on the planet does this. This is not unique. The SOD in this glycidin stuff actually comes from a melon. And it's a melon that's grown in France, and it's usable for humans because it is exactly the same. The sequence is 151 amino acids. It is identical in this melon as it is in us. And so we eat it.
What melon is it? Just like a cantaloupe kind of thing, or watermelon, or
the Latin name is Cucumis mello, but it's a cantaloupe.
nice.
And it's interesting history behind that. So it's grown in the south of France, and it was actually the farmers had an intention of breeding their melons to have a longer shelf life. Because, of course, to a farmer, one of the issues they face is, getting their fruits to market, and how long does it last on the shelf to make sales. Right. So they bred all their melons together that had the longest shelf lives, and they came up with this melon that could last for a month on the shelf, and it was amazing. And it tasted like crap, so nobody wanted to eat it. So that was, unfortunately, a lot of effort. However, somebody was smart enough to ask the question, okay, well, you spent the time breeding these melons. Why are they lasting so long on the shelf? What's the special ingredient? And they found that it was a very high level of superoxide dismutase. So you can get this SOD from any plant source anywhere, or animal source for that matter. It's a question of how to purify it, how much is in there. And these melons have a very high concentration, and that's the reason.
But when you're eating it, you still have the problem that your body's probably going to digest it, right?
Exactly. Yeah. So if you just ate this melon, it would do nothing. So the process with these melons is to isolate the SOD and then go through this process of encapsulating it or complexing it with the gliadin, And then that allows the oral bioavailability to be able to take it in by mouth and actually have it do something.
And so this this glycidin, am I saying that right?
You got it exactly.
So it's over the counter.
Yes. Yeah, it is.
And,
It's available on Amazon in the US and in Canada now as well. So you can order it for yourself.
so and besides myself, you know who I know? I know my daughters are going to be off it because they're both very strong, and one's a chemical engineer and the other is, knows a lot of chemistry, neuroscience. So I'm going to ask questions on their behalf. One, is this something that's safe to take when you're breastfeeding?
So excellent question. So as with anything else, there has not been a safety study particularly on pregnant women. But I can tell you, first off, I mean, it's completely plant derived. There's nothing synthetic in this. It actually falls into a category of medication or substance called nutraceutical. And that's both Canada and the US. And what that means is it needs, FDA, Health Canada approval of data. There needs to be submitted data to make claims. However, it can't contain any synthetic components. So it's all plant derived. So it's just the, gliadin from wheat and this SOD from the melon, and that's it. So having said that, if you eat wheat and or melon during pregnancy, it's not going to cause you any harm. There's no reason to think that this would either.
But the difference is that the stuff you eat in the melon is going to get digested, and this stuff is going to come through intact and wrapped around that gliadin.
Well, again, while there's no study that confirms safety in pregnancy I was about to say pediatric, but actually there are some pediatric studies now. I can say that I had two boys. I absolutely had mom using glycidin, and I gave it to my two kids when they were very young. When they were just a few years old, I got them started on that. There are studies. There was a very interesting study that was done on it that came out just a couple of years ago in France on asthma and immunology, showing improved FEV1 or pulmonary function tests and reduced immune markers in kids, or inflammatory markers rather, in kids that were using this in addition to their regular puffers, and it actually increased the efficacy of the puffers and reduced the frequency of use. And again, it improved their pulmonary function tests and reduced inflammatory markers. So, and this was, in kids. So this was a pediatric study. There has been studies on this stuff on cardiovascular health, metabolic syndrome, athletes. There is evidence that it reduces lactic acid buildup in cells and improves the recovery from anaerobic exercise. So many different things. And again, this comes to a root cause level, and in my opinion, while there's lots of different hallmarks of aging and lots of different drivers of aging, if you had to look back, if you're tracking back that stream and looking, what's upstream, what's I think personally, reactive oxygen species are at the top of that spring. I think that's the thing that's trickling down, that's causing all the other things. I think reactive oxygen species are the number one driver of aging. And there's lots of things that increase or the trickle down effect, whether it's the senescent cells, or whether it's methylation and damage to our DNA. I think everything else is a trickle down. I put that near or at.
I mean, oxidative stress is a major cause of cancer as well. So I mean, there's no doubt about that.
Now, this could be such a dumb question, so please excuse me if this is a dumb question.
Oh, that's a dumb question.
So looking at the top then, and then talking about ROS then and the effects that it has, how would I know that there's an imbalance then? And when should I then take SOD? Is there, because you mentioned that you gave it to your kids, right? Is there a specific age? Are there signs, or should everybody just take it? What does that look like?
Okay, well, first off, to accept my bias. I am 100% biased. I believe in this stuff. I've been taking it for 15 years. I believe that this thing helped me through a lot of different things, amongst them a neck operation. So as a surgeon, I ruptured one of the discs in my neck because my head position was always down while I was using my loops. I ruptured a disc in my neck. I had surgery. I had one level of my spine fixed and an infusion done. I recovered in 5 days. I mean, that is a recovery that's supposed to take 6 weeks or more. I was back operating within 5 days. And it was because I had already been taking this stuff for several years before that happened, and my recovery was much better. I've seen the same thing in my patients, by the way. This is how I started using it in my practice. This was introduced to me by happenstance, and I personally had no knowledge of it. I had no regard for it. I didn't believe that it worked one bit. And I started offering it to my patients as just being part of a holistic surgeon and thinking that I wanted to show them that I really cared. And what I saw was dramatic change. So, I mean, that was what got me interested in this in the first place, when I recognized the difference it made for patients and surgery. But, back to your question, who should take it? My personal opinion, I think everybody should take it, because we are all subject to oxidative stress. And we're subject to that continuously. It's not like it's a today problem and tomorrow it goes away. Now, you've shared with me a little bit about an injury. So, injuries are okay. Well, we just prior to coming on a recording, we had a little discussion about that, and I said, a couple things I recommend for you. One is hyperbaric oxygen, and the other is this glycidin stuff. So, injury is a classic place where there's reactive oxygen species. There's this circle.
But don't you get a lot of reactive oxygen species from hyperbaric oxygen?
Great question. So that comes back to the hormesis, right? I mean, those reactive oxygen species do cause some benefit because they're very short-lived. And having said that, it's a topic that I definitely want to look into more. And I have not seen any research that really answers this question. Does the SOD in glycidin short change or short circuit the benefit of hormesis of the hyperbaric oxygen? My personal answer is no, I don't think so, because it's impossible to completely eliminate oxidative stress. So the hormetic benefits of hyperbaric oxygen from the oxidative stress it causes, I still think that you get those benefits. However, there was a study that looked specifically at hyperbaric oxygen as a model of oxidative stress, and divers who were subjected to it, and they had something called a COMET assay, which, as you know, and for everyone else to understand, is an assay. It's a measure of DNA damage. So it's a way of looking and seeing how much is your DNA being damaged in real time, like right now. So what this showed is that the divers who had taken glycidin for a couple of weeks before going into that chamber, their COMET assay showed less DNA damage in the divers who were taking it compared to the ones who weren't. And in fact, even before they went into the chamber, after the 2 weeks of pre-treatment, the divers who had taken the placebo control, their COMET assay actually showed more damage at rest, even without the hyperbaric oxygen. So the hyperbaric oxygen just exaggerated that difference and showed that there was definitely DNA protection. So put all that together, that study showed DNA protection from this stuff, which is a remarkable finding. And secondly, that specifically in oxidative stress of hyperbaric oxygen, it was able to protect those divers. So, coming back to Taylor and, what you're going through, my thought, and again, there's the potential of short-circuiting some of the benefit of hyperbaric oxygen with this SOD. I personally don't think that that's the case, and I think that you'd get the best of both worlds with that. But there is a positive feedback cycle between reactive oxygen species and inflammation. Inflammation causes more reactive oxygen species. Those cells are busy, their metabolism goes up, and they're not functioning normally. There's a ton of inflammatory markers or inflammation mediators there. Those cells aren't functioning the way they're meant to normally. They're busy trying to produce stuff to heal wounds and prevent infection. So reactive oxygen species builds up there, but the reactive oxygen species then also cause more inflammation. So in a site of injury, there was this positive feedback cycle. One of the things that you notice after an injury or a workout or surgery is that the peak of inflammation, the peak amount of pain and swelling is actually about 2 days later. And you might ask the question, why? Part of that is because there's time taken for the white blood cells and the inflammatory cells to actually get there and cause a reaction. And part of it is because there's this ramp up of these cells getting angry and inflamed and causing more reactive oxygen species, which then causes more inflammation. And it gets to this peak where your body kind of gets it under control and then takes it back down again. But there are plenty of studies that have looked at this SOD supplement, this glycidin stuff, that shows that the peak amount of redness after laser treatments or after exposure to ultraviolet radiation is lower. So the amount of inflammation is reduced and the recovery is faster. So, all that coming back to you, Taylor, and responding to injuries, that's to reduce the inflammation and help your body actually spend its energy on repair rather than being inflamed. This is something which I believe can help.
I wish we had this podcast a lot earlier because I'm at week 5 of my post ops. And for everyone listening, I ruptured my patellar tendon, complete rupture, and so I've just been icing it and just doing the traditional methods of, I guess, healing and elevating. But, that's super fascinating though.
I just want to piggyback a little bit on that whole concept because neurodegenerative disease, atherosclerosis, metabolic derangements, and especially cancer, all happen in that high oxidative stress inflammatory milieu. That has been well studied, and there's settled science behind it. So that's part of what I'm going to guess, Dr. Goldberg. That's part of what powers your confidence, and that this being
Exactly. Peter Attia refers to the four horsemen, right?
yeah.
And metabolic syndrome, cancer, cardiovascular, neurodegenerative disease. Every single one of these things that kill people, the cause of them, ultimately, at least partially, and in a majority, in my opinion, is reactive oxygen species. It's oxidative stress. This is the key cause of all of those things. And of course, our diet, our lifestyle, and all that is sort of the behavioral and functional contributing factors that cause this. But the reactive oxygen species, I personally think, are at the top of that river. That's the inciting injury that's causing everything else after it. And if we can get on top of that, I think that's going to make a huge difference in our overall health span and beauty span.
And so the superoxide dismutase can deal with the oxidative stress once it happens. Just if you could encapsulate like what you would tell your boys or what you would tell medical people or non-medical people, what are the those handful of things that if you didn't do anything else, do these things to reduce your oxidative stress? Like I'm guessing one is reduce exposure to sun and radiation. Another might be avoid inflammatory states caused by X. So give us the Dr. Goldberg primer on how to deal with this issue that has plagued biologic life for 3.2 billion years since the advent of chlorophyll and oxygen being thrown up into the atmosphere.
Sure. Well, let's I'm a plastic surgeon. Let's focus on sun. Sun exposure is absolutely a huge driver of oxidative stress in our body. I mean, you think of your skin as being a radiation suit. We're going out every day and exposing ourselves to this giant nuclear power plant in the sky, and worshiping it, while our radiation suit is busy absorbing it and trying to prevent the rest of us from getting irradiated.
The northern lights look good, but probably not that great on your skin, right?
Yeah, well, I mean, thank goodness we have those levels of stratosphere, and that causes the northern lights. Thank goodness we have that. I mean, those levels are the levels that actually absorb that radiation.
Yeah.
Without that, that would be even worse. I mean, that's how life on the planet exists, is that we have that protection. One of the really fascinating things about the damage to our skin from radiation is that it actually isn't directly from the radiation. So, most people think there's UV. UV is bad for me. Take that one level up. Okay, there's UV, and there's actually a whole bunch of other types of radiation. There's cosmic mu mesons and heavy particles, things that zing through buildings. I mean, it doesn't even need to be outside. These are hitting you all the time. You can go 5 miles underground and measure these things. These particles are that powerful. So all these particles, all this ultraviolet radiation, all these radiation, it's hitting you. However, the likelihood of one of those particles, the particle of the radiation, actually hitting your DNA is very low. And it's because it's so small. And molecules and matter are mostly space. So in fact, UV doesn't really hit your DNA, but what it does is it leaves behind a track of reactive oxygen species, and those reactive oxygen species, they then spread out and damage everything around them. So ultraviolet radiation and other types of radiation, the principal way that it harms you is actually through reactive oxygen species that they produce. And yes, sometimes they do hit your DNA or they cause a direct injury, and that's very real. But the majority of the damage is being caused by the reactive oxygen species that it's producing, So if you want an easy way to reduce your reactive oxygen species, stay out of the sun. Use your sunscreen.
How about diet?
Diet. Okay. So again, let me disclose my bias on diet. I follow a largely plant-based diet. I've been doing that for 7 years. My wife Stephanie, she and I 7 years ago made the decision that we were going to go. We went vegan at first, and then I went to more what we call plant-based. And the reason I call it plant-based is because we get, I would say, at least 95% and probably around 98% of our calories from things that grow from the ground. And every once in a while, if we're out somewhere, we'll mix in some fish or, some other animal, only sea-based animal proteins, never land-based. So that's my diet. So that's my disclosure. The reason that I think this is so important, eating animal proteins is really harmful for you. There are amino acids in that actually, block the healing mechanisms that you have for your epigenetics. They cause all sorts of inflammation in our bodies, and it is a huge producer of reactive oxygen species. The worst culprits are all the processed foods, and even the worst of that is the processed meats, salamis and the prosciuttos and all those cured, dried, processed meats. Those things are like poison. It is literally like eating poison and killing yourself slowly. Stay away from that stuff.
Brutal. Our listeners are going to hate that. They're probably going to hate this. They're going to hate this next question too. What about alcohol consumption? Ethanol, alcohol.
Yeah. So
a martini. What's going on there? What kind of oxidative stress we getting out of a martini?
Absolutely, it does. It causes oxidative stress. Alcohol on its own causes lots of harm to cells. Lots and lots of data has now come out that even small amounts will cause, cognitive decline. And, the question might be asked, well, how? Like, what's it doing? Oxidative stress. That's one of the principal things that it's causing. And it's backing up. It's causing your organs to dysfunction. It's functionally poisoning them. And so this is, why you get disinhibited, because your brain is actually being poisoned. It's being inhibited. And that results in the production of reactive oxygen species, which then cause harm to the surrounding cells. So, my position on that, I'm not that I was ever a heavy drinker, but about 8 months ago, I made the decision that I'm done. I'm off. So, I have, been without alcohol for 8 months. Every once in a while I'll hold a glass so that I can appear like I'm drinking. The social part of it is definitely the hardest part for sure. Yeah. But I made that decision because of all the evidence around it. It's unquestionable the harm that it causes, and reactive oxygen species is the principal way it does it.
Yeah, similar here. Yeah. I can report that the non-alcohol containing IPAs are excellent. They really taste about as well as they taste great. I'll just say that. And then, any other, how about sleep and lifestyles sleep and exercise? How important is sleep and minimizing oxidative stress?
It's vital. And it's interesting. Sleep science has come a long way in the past decade or so. And I think that there's still a long way to come, but my thoughts about sleep. I think that there are a lot of functions of sleep. I think that there's a thing called the lymphatic system, which is like the lymph system of the brain. It's the lymph system is, for the rest of our body, the way that we drain toxins and help to clean out cells and organs. The lymphatic system in the brain is the lymphatic system of the brain. It's a way of draining toxins. It's very active while we sleep. There are lots of benefits of sleep, and it's very necessary. I think that one of the prime motivators of sleep actually is, again, this redox balance. During sleep, our NADH levels decline, and it gets converted back to NAD because our cells enter this sort of quiet and relaxed state where they're not needing to produce so much. Metabolism is slowed down. They have the opportunity to catch up and convert some of that NADH back to NAD, reverse some of that reduction, and prime your cells and get them ready for the next day. So the amount of sleep that you need and get would be very much dependent on your redox balance. So I
got to get those balls pushed up the hill.
Yep, and your body is going to do it better while it's just working on that and not having to keep you
and not having more balls rolling down the hill.
Exactly. So your nighttime activity is kind of rebalancing things and getting that reduction oxidation balance reset. And so I think that those two things fit together. And so again, coming back to a root cause, I somewhere in here see a universal picture of your redox balance is related to aging and your overall health at a root cause level. And I think that our circadian rhythm and sleep is very much related to maintaining that redox balance. And it is an evolutionary thing that was, sleep evolved at a very basic life form
Right.
state, right? I mean,
Right.
very roundworms, the most simple organisms have these quiet times of early forms of sleep. Why? I mean, they're not out doing what we do. They're not being human and
It would
walking
be
around.
a huge evolutionary disadvantage unless it was vital.
So, if it was that vital that it evolved that long ago and it has developed to what we have now as our sleep cycle and beds and all that kind of stuff, but this started way back when. Again, what was present, what was there? It was chemistry. It was the very simplest function. And what's in that chemistry that at a most root cause fundamental level needs to be corrected. It is the redox balance. It is the imbalance of oxidative stress that builds up during functional time during the day. And our nighttime is the opportunity. And for a simple organism, it doesn't have to be a night or day thing. It can just be whenever there's a need that imbalance exists, it slows down, recatches that reduction oxidation balance, and then it's ready to function again.
I, I have a quick question. So, as a practicing physician and listening to you, which has just been a real incredible treat, what does what does your practice actually look like? How do you do the surgery and the holistic approach? I mean, they come in your door over here, and there's like superoxide dismutase up this wall, and sunscreen down that wall, and umbrellas over here. No, I'm kidding, but I mean, and oh, by the way, I can do that facelift or the implantations and whatever. What's your practice look like? This fascinates me.
Yeah, so I would say my practice is in evolution, and it's one in which I am adopting more and more of these strategies and trying to figure out how to fit it in the aesthetic world in a way that I can help other people do the same thing. Because as I said at the start of the conversation, I really think that we have control over the people. We have them, their captive audience, and this is our opportunity to make a change. So, my practice, I still operate. I mean, I love doing surgery, and I'm cautious about who I pick and choose. And I have adopted techniques in my practice. I do a particular type of a deep chemical peel called a phenol croton oil peel. These peels are like super deep. They actually reduce senescent cells and reduce actinic damage, sun damage. So it's a way of reverting skin and reducing aging. So, I'm kind of adapting my techniques to have that more holistic approach. But I'm still offering surgery to people in the right context, but then trying to transition them. So practically speaking, I'm still a surgeon. But at the same time, I'm also in the background building, and I have partners and a lot of a broad network of really supportive people. We're trying to create this tool for other clinicians to offer, and we're building our own spaces to do the same. So, my practice in the next year is likely to transition to a place where I'm actually going to have a physiology lab and a longevity clinic and access to all these tools. And at the same time, in the background, I've helped to co-found a company called HealthSpan Digital. HealthSpan Digital it's a longevity as a service company. So it's where we offer turnkey solutions for people who want to offer longevity, whether it's, adding physiology labs or supplements or IV or protocols. We help people launch longevity clinics or longevity tools within their private, primary care practice or aesthetic practice. So, the objective of this company is to create the tools. So, my practice is a little bit of a petri dish. We're kind of testing out different things,
Yeah.
and I'm working with different partners to implement these tools. So, it's an iterative process, and I'm
Oh,
learning
wow.
lots. But in the next few years, I really hope to sort of make this mainstream and help our industry go through this kind of evolution to the next step of or next phase of aesthetic medicine, at the same time as fostering these longevity tools to the community and the public. I really do see this as a huge public health issue. The population in the U.S. is the same as everywhere else in the world. It's aging. Canada is no different. We all face the same issue: aging population. All these diseases, the four horsemen, and they're real. People need to be healthier. It's a crisis. So, adopting these tools in an aesthetic world allows us to graduate that to a bigger picture, and offering these tools in an accessible fashion and offering it to primary care and wellness and all, whoever wants to do this can. Doing that will democratize these tools. And I think the democratization of this and the offering of it to the public in a cost-effective, reasonable manner, that is going to be a huge public health change. And I think that that's the next phase of healthcare.
Oh, that's really exciting. Very exciting. At Biography Health, we're doing a little bit of that in the precision. We're kind of a precision medicine in a box, for primary care clinics. If you want to, start from medicine 2.0, how do I practice some of this medicine 3.0? How do I try to be predictive? And you're right. The problem is that it's hard for primary care practices to evolve over time. That's what you've been doing, and you've been, the petri dish, so to speak. And you've been the cell culture, as it were. And so you figured out how to do this, and you are packaging it up. What again is the name of that company?
HealthSpan Digital.
Bend, BEND.
So HealthSpan Digital. So
HealthSpan Digital.
Yeah.
Sorry.
Yeah.
My senescent hearing cells kind of caught up to me there. Really cool.
The website is healthspan.digital for anyone who's interested in looking into those tools.
Great. Well, I know for sure we're going to have you back. There's so much more to talk about. Go ahead.
Doing an in-person podcast at some point as well. So I'm excited for that time too. And Dr. Goldberg, if somebody wants to reach out, learn more about you, learn more about your services, what's the best way that they can reach out to you?
On Instagram, Dr. Cory Goldberg, MD is my handle. I have a website, beautyspan.com. So beautyspan.com, sort of a place where we're putting a little bit of the information and details around this beauty span concept. And you can sign up. We'll be sending out newsletters in the not too distant future. So certainly happy to hear from people either on Instagram or if they want to check me out on that website.
Awesome. Well, gentlemen, thank you so much for this insightful conversation. I've learned a lot. My mind was actually pretty blown throughout this whole entire conversation. I feel like I'm going to need to listen back as I'm editing this. I'm just going to be taking notes again. So thank you both for your time. It was great.
That was just amazing. You're a world-class speaker and explainer of these scientific concepts, Cory. That was really amazing.
Thank you. Thank you so much.
Peter T has got nothing on you.
You're so kind. Well, I mean, Peter is a surgeon himself. There's something very practical about being a surgeon when you have your hands on people's tissue. But guys, I want to say thank you so much. It's been a real pleasure. I've enjoyed the conversation. It's not going to take a lot to convince me to come down to California. I did my fellowship there at the Los Angeles Children's Hospital. I love it, and I definitely come for a visit. I would love to do a recording in person.
Yeah, we'll hook you up. Well, as soon as the weather in Toronto gets to its absolute worst, you need to hightail it down here.
Sounds like a great idea.
Thanks for joining us on the Precision Medicine Made Simple podcast. If this episode inspired you to learn more about your health, please leave us a review and share the podcast with a friend. Your feedback helps spread the word about the power of precision medicine. Remember, taking action today can lead to a healthier tomorrow. See you next time.